Right, guys, we are on the last article in this issue of JAVMA. This is from February 15, 2015, and we're going to be talking about surgery and electrochemotherapy for the treatment of cutaneous squamous cell carcinoma in a yellow-bellied slider. So this is a turtle article. This comes out of various locations in Italy. Let's see, Rome and Naples. 5-year-old female yellow-bellied slider had a 2-month non-healing ulcerated mass on the dorsal aspect of the neck. That's this image right here. So this is the top view of the turtle's neck, and there's a lesion. And by the way, this is annoying. I mean, if you're going to take a picture and put your hands in there, first of all, wear gloves, and secondly, get rid of the jewelry. I mean, make it look professional, Anyway. The mass was 2 by 1.5 centimeters. It was ulcerated. They did total body radiographs and hematologic and serum biochemical analysis. The turtle was then anesthetized. The mass was surgically removed. They then treated the tumor bed with electrochemotherapy. They did 2 sessions with a 2-week interval between treatments. And they also administered intratumoral bleomycin, followed by trains of biphasic electric pulses. The turtle was disease-free after 1 year. So in addition to the testing, they did also urinalysis. The blood work found a mild anemia and leukocytosis characterized by heterophilia and eosinophilia. Heterophils are the turtle and bird equivalent of neutrophils. They found no abnormalities on urinalysis or on the whole body radiographs. They gave the turtle propofol through the supravertebral sinus. The turtle was hospitalized for 24 hours, received IV fluids and antimicrobial treatment with enrofloxacin given intracolymic route. The enrofloxacin was continued after surgery at home along with meloxicam for analgesia. The biopsy came back as incompletely excised, well-differentiated squamous cell carcinoma. Options then included surgical revision to remove the rest of the mass because it was incomplete margins, radiation therapy, photodynamic therapy, laser therapy, or electrochemotherapy. The owners elected for electrochemotherapy. The surgical scar and a 1 centimeter margin of unaffected tissue were injected with bleomycin. And then 5 minutes after the injection, they did trains of eight biphasic pulses at the voltage of 1200 volts per centimeter at a frequency of 1 hertz, lasting 100 microseconds. So that means a biphasic pulse that was 50 plus 50 microseconds. With 8 300 microsecond interpulses, total treatment time per centimeter was 3.2 milliseconds. Administered with a clinical electroporator certified for veterinary use. The procedure was performed with the turtle under general anesthesia with propofol. The turtle did not develop any adverse effects. There were no abnormalities found on blood work a week later. A second round was performed 2 weeks afterwards. Physical exams were performed monthly for 3 months and every 3 months, with total body radiographs obtained to check for possible metastatic spread. After 1 year, turtle was disease-free with a good quality of life. And then, just like you see up there, here is the close-up there of the biopsies. And then in photo D, you can see the turtle looks pretty good. Discussion. Electrochemotherapy consists of intratumoral injections of chemotherapy like cisplatin or bleomycin, followed by local delivery of electric pulses to potentiate drug uptake. The electrical currents are applied in biphasic pulses and induce clustering of the transmembrane proteins, thus increasing drug delivery. Treatments are delivered in 1 or 2 weekly sessions. Electrochemotherapy, a combination of high-voltage electric pulses and administration of anti-cancer drug, has been demonstrated to be highly effective for the treatment of cutaneous and subcutaneous tumors regardless of histologic origin. Unique properties of electrochemotherapy, meaning a high specificity for targeting cancer cells, high degree of localization of treatment effect, and capacity for preserving innate immune responses and the structure of the extracellular matrix are facilitating its clinical use. Cutaneous squamous cell carcinoma has been described in snakes, lizards, and turtles. Cutaneous squamous cell carcinoma is more frequently seen in monitor lizards, especially in the skin of the face. In snakes, it's most commonly found in the cloacal region, coming from scent glands, the hemipenis or skin of the cloaca. Cutaneous squamous cell carcinoma is occasionally seen in turtles, and these tumors are well differentiated, locally invasive, and invoke a scurrous response. Scurrous means like a scar tissue type response, and that makes sense with what you're seeing here. Metastasis is generally rare in turtles. These tumor characteristics are consistent with those described for the turtle of the present report, which developed a single non-healing ulcerated lesion that was persisted for months on the dorsal aspect of the neck. So yeah, that's pretty cool. These new therapies to treat cancer, the problem with treating cancer, I mean, that's a whole discussion, but it's the cost, the morbidity, mortality associated with it. And so anything we can do to either not use chemotherapy or to find a way to use it in a more intelligent manner, it's going to be beneficial for everybody. All right, this issue of JAVMA is done, and we're going to move on to the next issue here for the next video. There you go. There it is. And thanks for supporting the channel. Please subscribe and hit like and all that stuff. We'll see you in the next one.